the young insulin dependent need insulin. And there are plenty of insulins, rapid, medium acting, long acting, you've got cartridges, you've got insulin pump. A lot of new developments these days. These days they are implanting insulin cells, etc. But regarding the medications, I take it. Either you stimulate the pancreas to secrete more insulin, or you prevent the liver from doing a lot of sugar, or you reduce the absorption of sugar from the intestine, or you ask the pancreas to do better insulin. Okay? The drugs that sensitizes, called sensitizing. The insulin resistance, we sensitize the target to the effect of insulin, making you make better keys to open the door. For guidelines. Lifestyle change, as you can see. Here, nutrition and these sort of things are very important regarding diabetes. Okay, I have to move. Now, I'm going back to the heart now. I finished with diabetes. What is ischemic pain? We have described it. It is that pain that is triggered by effort and relieved by rest. And what do we mean by this? When you exercise, the heart muscle will need 10 to 20 times the oxygen, you see, that she uses when at rest. But if the artery is narrowed, what happens? Not much blood goes in, God Almighty will ask you to stop. So that pain that stops you and is relieved by rest. When you rest, you restore the balance between the demand and the supply. Now, let's come here. This is chest pain, okay? So an ischemic pain for the heart is called angina. Okay. Where is the location of the pain? Okay? This is location is central. Okay? It may shoot to the back, it may shoot to the arm, and it may shoot to the neck. These are all typical pains. Now, what is the character of that pain? Is it that pricking pain that you see all the time? Does anybody know? What's the character of pain? Nobody knows. I'm glad. This is the character of pain. Vice-like, compression, oppression, pricks on your heart. Okay? Not the pricking pain under the nipple. Okay? This is atypical sides. Now, these sides are atypical, and I ask you a question, can the ischemic pain present in other clinics? Yes, it does. Gastroenterology unit will receive the ischemic pain. They present as indigestion here. Even the dentist will keep plugging your teeth because you get tooth pain. Huh? And he thinks it's through the teeth, it turns out to be ischemic pain, pain of the heart. The ear chap, get pain here. You get pain in the throat, the ENT man. You can get pain here in the shoulder. You can get even pain in the wrist. But the common denominator in all, with exercise, when you stop, it goes away. Okay. Now, what happens if you ignore this pain? What happens to angina if you ignore it? This is that question. Does anybody know? Yes? Huh? Yes. This is half the answer. You get what we call unstable angina. Unstable angina, if the pain, usually the pain lasts for a few minutes. If it lasts more than 20 to 30 minutes, then you're in trouble. You are in danger. Your artery is occluding. And this is called unstable angina. Now, this unstable angina is an emergency. You should go straight to hospital. They should hypernize you to make your blood thin, give you vasodilators. If it passes unnoticed, that's great. You have to do something else later on, or it may go into infarction. Okay? Infarction is death of the muscle. Now, I've got one question which myocardial partial. You're right. You get small death, not enough to kill him. What is the killer in the first 48 hours? Nobody knows. Nobody knows? Arrhythmia. The reason why those coronary care units, intensive care units, are founded to monitor early those rhythm changes, because these are the killers, not the heart. In the first 40 are the killers, are the rhythm changes. Drop, it goes into ventricular fibrillation, because like this heart cannot pump, it goes up. Okay? So this is the killer in the first 48 hours. So beware, if somebody with chest pain, straight to hospital. Not take it. This is the pain of the legs, again ischemic pain, because intermittent claudication goes to gangrene. I'll go further. Forget about this one. The risk factors: diabetes, hypertension, smoking, high lipids, as we said. I'll come to it later. Family history, obesity, inactivity. You know all this. If you can avoid those risk factors, you can prevent this ischemic pain. You can prevent abortion. And believe me, ladies and gentlemen, it's never late to fight against those risk factors. It's never late. Okay? Coronary artery disease. This is the coronary arteries. This is the right coronary artery. This is the left coronary, divided into two portions. The left anterior. This is the artery of sudden death. Blockage in here will kill you on the spot. This is the circumflex, and you can get blockage anywhere in the pathway. The more proximal, the more dangerous. The more distant, the less dangerous. Now, this is narrowed artery. What does this narrowed artery signify? It signifies ischemic pain. Okay? What is this here? This is the pain I told you. The rare, atypical heart pain of angina. Then this plugging all the teeth, poor chap. ENT chap, it puts an oros, finds nothing, it says, well, go away, you're a neurotic. Nothing wrong with it. Okay? Again, this is the infarction, which you have seen. This is another one you have already seen. This is the blockage here. And this one muscle is lying. Never mind, it's nice too quick. The management. Nitroglycerides put on your tongue to vasodilate, to reduce the pressure load on the heart, and thus the pain goes away. Or use vasodilators, use beta blocker. The most important two are here, these three. This thrombolytic therapy, it can abort an attack of myocardial. Just very expensive, $200 or $300 dollars an ampoule. If you give a shot in the first 24 hours, or in the first 6 hours in particular, you will abort the attack. You will open the blocked vessel. Very life-saving, and at the same time, it aborts the attack. It goes back to normal second day. This is what happens with Hariri, what's his name, the president of, he was giving the presidency to somebody else in Lebanon. He got the attack on the day. They just put him in, they injected this injection, and they put a stent the next day, and the next day he handed the president to somebody else, to Hello, whatever his name. It happens. This Dick Cheney, every time he do like this. Okay. Well, I mean, here, the statin. This is the most important thing, in my belief, in the long term. This is a drug that will lower your blood lipids, the cholesterol. Lowering your blood cholesterol will cause the liver to regress. Very promising, and should you use it, the liver will stop producing the cholesterol, and the cholesterol will start moving from the vessels to the liver. Statin. I personally use Lipitor, which is a very good drug. There are plenty of them, all of them are good. But I personally experienced with this drug. Okay? Then here, the anticoagulants, and the best you can think of is aspirin. So there is no harm in taking one aspirin a day, children aspirin, but be careful from one thing, which is rare, but it may pass unnoticed. Now, if when you watch your motions, stool motions. Okay? You find it black in color, then you are bleeding from your stomach, from the aspirin. You will not be aware of it. So please, if you're taking aspirin, many people over 40 or 50, they take aspirin, or people are at the risk, okay, to keep their blood thin. So when you take aspirin, please watch daily your stools. Take only 1 second. Because if you don't watch it and you're having it for a few days, it might kill you. You start complaining of symptoms of anemia, weakness, tired, lethargy, palpitation, this is anemia. Many doctors may not notice this or may not know the cause of it. They may not know they're taking aspirin. So you better be careful. When you use aspirin, I'm not telling you to stop it, no. This is very rare, but it can happen. Okay, now let's go to hypertension. There we are. This is the last bit of our talk. Hypertension is the third killer. This is the silent killer. It's a common killer because 600 million people in the world are suffering from high blood pressure. It is a silent killer because it doesn't give you symptoms. Unlike what people downtown say. Headache, check your blood pressure, usually the blood will go up when you're tense. Oh, this headache is due to the hypertension. This is rubbish. It doesn't give you any symptoms. It gives you symptoms after 10 to 15 years from its onset. So, it is silent, this is bad, but it is at the same time merciful. Why merciful? It gives you enough time to treat yourself. Get the blood pressure down, you will not die of anything. So you are preventing this killer from attacking you. Get it down. Okay, now we would like to know the systole and the diastole. I have it in the papers there. The systole is the highest, the diastole is the lowest. Position of the sphinx, it has to be with the level of the heart. When you use the machine, it has to be with the same level of the heart. Okay? Now, I mentioned the headache. Salt intake. Salt is very important. Hypertension, please cut down on the salt. I don't ask you to eat a bland diet, but if you lower the salt, you will reduce your blood pressure. If you lower your weight, you will reduce your pressure. And if you lower your weight by 5 kilograms, even though you're very obese, you will get your systolic blood pressure go down by 5 degrees. This is documented. Okay? So pay your money, take your choice if you're hypertensive. What is the effect of hypertension on the heart, on the muscle? What kind of thickness here, what kind of thickness here? The hypertensive heart got a thick muscle. Why is it thick? Because it's hypertrophy. There is a stress on the heart. He's pumping blood through a high blood pressure, high lumen. So what happens to the heart? It's hypertrophy. But there is a limit to the hypertrophy. And the limit is that there should come a day where it fails. And when it fails, the patient goes into failure, heart failure. Now what happens if the heart fails? It usually pumps forward to the arteries to nourish the body. If it fails, the blood will return back to the lungs. So the lungs become congested. So you will get what? Does anybody know? All of you are tired. I'm sorry, I'll keep you so long. You will get shortness of breath. But an important point I want to stress, when you are sleeping at night, you're hypertensive, whether treatment or no treatment, and you become all of a sudden short of breath, wake up, gasping for air. This is an acute left ventricular failure. It's a warning. But look, your muscle is getting bad. You should take care. So when you wake up gasping for breath, then this means that your muscle is not very good. Okay. So that's as far as the muscle. Then we will go to the artery, which I've already told you about. You see? We talked about it. Come on. What is the effect of hypertension on vital arteries? And as we said, too much pressure on the arteries, what does it do? Normal. The artery will thicken. When you get exerting too much pressure on the artery will thicken to protect itself. But unfortunately, this takes place at the expense of the lumen, thus causing narrowing and later on blockage. And again, hypertension will attack you in the very same way the other diseases. Attacking the vital organs, the 5 of them, it's a killer. Treatment, very easy. Your part is exercise will lower your blood pressure. Reduce your weight will lower the blood pressure. No stress will reduce your blood pressure. No smoking will reduce your blood pressure. Because smoking causes vasoconstriction. Constriction, just increasing the pressure. Okay? There are a lot of drugs that are new, but the most recent one are the angiotensins. I'll talk about it on another occasion if we get the chance to. Okay? This is it. Now, coming to 2 or 3 more slides, it might be interesting to know the diabetic neuropathy. This is a complication which I have never mentioned it because it is not a vascular complication. So diabetes attacks 2 organs, the arteries and the nerves. Now, diabetic neuropathy, it could take different forms. We have peripheral neuropathy attacking your leg, sometimes the arms. Many diabetic patients after a while, or they could be presenting with this symptom. You get, doctor, I get numbness, pins and needles in my legs. Others will say, doctor, very hot sensation, especially at night. Hot sensation in the leg. I remember one occasion, one patient told me, look, doctor, my legs are so hot that when you put them in an ice cube, in Iraq we have ice cubes, big ones, they deliver to the house, to the shops. The ice melts. I said, yes, then? He said, and then it starts boiling. Okay? Then I told him, if you put a tea bag in it, what happens? He said, you drink tea. Now, what happens is you look at the leg, you feel it, the temperature is normal. So this is an abnormal sensation in the leg. We call it paresthesia, you call it pins, needles, tingling, walking on eggs, whatever it might be. Now, this is the sensory part. Then you've got the motor part, which is the proximal, here, the calves, the muscles of walking, those quadriceps. You see an athlete, very thick muscular quadriceps, or rather thigh muscles. After becoming diabetic for a while, especially uncontrolled, it becomes very thin. They waste. When they start to squat like this, you cannot get up. So combat this before it attacks you. Always do leg exercise if you're diabetic. Leg exercise. Not too much. You can do it in bed. You can do it while walking. You can do it while driving. You can do it anytime. Just contract and relax the calf muscles. I'll teach you about it if you need me. Okay. Now, sensimotor, you can have both. Then the other ones, you can get isolated neuropathy. This is motor neuropathy, and I'll show you what does this mean. This autonomic consultative. Here is a motor neuropathy, mononeuropathy, single nerve. Here this is the question. Which part is paralyzed? Is it this part or this part? This is the right part, that was the left part.
Right part.
Huh?
Right part.
Left part?
Right part.
This is the right part, and this is the left part.
Right part.
Who said left?
Yes.
Wrong. Who said left? Huh?
Right part.
Come on, speak.
It should be the right side
Why?
because the brain is controlling the
Nothing to do with the brain. You look at the features here. This guy, these are the muscles of expression. Okay? Now, Mr. Singh, give one of these guys who said right.
Yeah, that's right.
Or choose a good man. Okay? Now, here, when he cannot close his eyes, when he cannot move this, the other part will move. So, the mouth twists. We can treat this. 2 or 3 months, it clears off, it goes away. It may recur back again. Okay? On the other side. So, this is one part of isolated neuropathy. This is another part of isolated neuropathy. Wrist drop. Wrist goes down, you cannot elevate it. And you get foot drop as well, okay? Isolated neuropathy, paralysis of one nerve. When this one get foot drop, you get high stepping gait. Because, you know, the foot drops, you have to lift the leg to walk well, anyhow. Now, this is third nerve paralysis. There are two people who see double vision. Okay? One of them are the alcoholics. If you drink too much, you see double. Okay? The other are the diabetics. I'm sorry, there are many causes. Brain lesions, tumors, you can do this. This patient has got paralysis of the third nerve. And look at this eye, it is not moving. When the eye muscles are intact, the eyeballs move in a synchronous way. When one of them is paralyzed, this one doesn't move, this one moves. So when it moves like this, you see double vision. Okay? So this is third nerve palsy. Diabetics do have this. And this is a neuropathic foot. Loss of sensation in the foot. What happens? You get repeated trauma. You don't feel it. You don't take action. You get a crack. And then it becomes bigger. In fact, you don't feel it. You don't see it. You're a busy man. And little by little it becomes bigger and you get this ulcer. This is a neuropathic ulcer, but there are other ulcers which are due to disease of the artery. Blockage of the artery will cause another type of ulcer on top of gangrene, the plaque stuff. And I think we're getting to the end stage. Now, care of the foot, this is very important, ladies and gentlemen, and you have got to look after your feet to prevent amputation. Okay, we'll come to it. This is how it starts. Crack between the two fingers, the two toes. Okay, you don't pay attention. Usually it's fine. Clean your feet well. Change your socks to avoid this. Get company to crack the shoe for you if it is tight, so that you don't get any ulcers, you don't get any cracks in your feet, because simple infection, your blood is too sweet. Okay? The microorganisms will like this blood. So they live longer there. You can't get rid of them very quickly. So the healing is very, other than other factors as well. The blood supply is very poor. You don't get good healing, these sort of things. Okay? So this is good. This is a red one, infected, infection getting worse. This might progress to gangrene. Look, it's getting, this is black. Oh, look at this one, this is pale. You know why pale? This is pale. There is starting infection here because there is low blood coming into the leg. This is an ischemic leg. Becomes pale. Mind you, I forgot one symptom, or call it sign. When you get ischemic pain of the chest, the patient becomes pale and starts sweating. Pale and sweating. This is very important. With a chest pain, but comes with effort, stopping you. You become pale and sweat, that's very likely to be angina pain, heart pain. Okay? Now this one, pale leg. Especially when you lift the leg up, blood will pull down, it becomes pale. Sometimes these are very tricky. Other than this, you get night pain. You cannot sleep because of the ischemia. Constant ischemia, constant pain. Now, here is gangrene, and this will end up in amputation. The surgeon, the lovely orthopedic surgeon, he starts amputating from the fingers going up until he goes up to here, then he stops, little by little. Okay? Those fingers, ladies and gentlemen, you know, if you tap them like this, they fall down. Very bad order. So, pay your money, take your choice. You want to prevent this complication? Do as I told you. This is neuropathic ulcer as well, a part of the camera foot. And ladies and gentlemen, this is the last slide. This is a diabetic retinopathy. This is a longitudinal section. This is the retina, the inner nerve. This is the optic nerve that receives the perception from outside through the lens. And these are the hemorrhages, and these are the exudates, and this is another one, and these slides you're familiar with. So blindness is here. This one, strict treatment, will prevent this to progress, and this one needs laser beam to burn it out. The last complication, this is simple cataract, where there is opacification of the lens. You cannot see where this is blurred vision. This is very simple. Take it the opposite one, implant a new lens inside, and you see properly. So, ladies and gentlemen, hope that this tour introduced you to the simplest way to prevent accuracy. Ladies and gentlemen, I would like to get your feedback. As long as we have a camera, I would like to ask three volunteers, to give me your ideas about this lecture and what message you would like to pass to your friends and relatives when you depart from here. Would anybody like to volunteer? Come on, I've been talking for 3 hours. Have mercy on me. I would like to see the response. I'm interested in the message. Nobody wishes? Yeah, okay. What?
But I want to tell everybody they should
Yes, okay. No, hear the voice only. The voice only.
We should start doing exercise
Yes.
every day, at least for 1 hour, and healthy food. So they will solve any problem they have, even if it's a start. And if they feel that there is any pain or any problems from beginning, they should fix it. To go to the doctor or to know what's the problem from beginning, they can solve it before
Great.
it's coming more. And the exercise is the first point, and
So you stress on lifestyle modification.
yes.
And now you're talking in terms of a therapeutic lifestyle changes. Therapeutic, huh? Not only modification. You've done very well, and I thank you very much. I'd like to have another speaker. Okay. Where are we? Come on, gentlemen, please. So this means that you had a poor response, you have nothing to tell your friends, and I'm really depressed. I am depressed.
Hello, sir.
Because the idea of this lecture, yeah, that's great.
Yeah, good afternoon.
Now, what did you think of this lecture?
This lecture is very good, particularly for me. I have not gone to the doctor so far, showing these things. But I feel that now I have to go. So they should, to find out actually what exactly is there in me. Right? And I also tell my colleagues and everybody to have a checkup if they have the problems or symptoms of this kind, apart from exercise and the food diet.
Lovely. Thank you very much. Thank you very much. Anybody else? Yes, gentlemen. Now, this gentleman, he is an old man, experienced man. If there was somebody who had hypertension, heart disease, diabetes.
Without any problem.
Huh?
Old men without any
Come,
problem.
come.
Thank you for selecting me actually. A lot of people raising their hands, so smoking, all those. I am not suffering with any of this sort of disease. I'm
So
totally
what
fit.
message would you like to pass to your colleagues, to your relatives?
I'll have to have a word with my wife. She's suffering hypertension and blood sugar, diabetes. She's an acute diabetic patient. I have read a lot about it, and I'm definitely going to talk to my wife, discuss about these problems, try and ask her to take preventive medicines.
Thank you very much. Anybody else? Come on, I need 3 more. That gentleman, yes, lovely. Number 1, what did you think of these lectures? Are they fruitful, informative, instructive? Shall we continue with them? Shall we stop? And then the message you wish to pass to your colleagues, friends, relatives. Okay?
Okay, you talk about this chest pain.
Yeah.
Yeah, this sometime when we are going for exercise and walking, and after maybe half an hour, let's start any side chest pain. And what we can do?
Oh, you asked me a question? Well, in the first place, decide whether this chest pain is ischemic or not. 90% of the chest pain in the town are due to chest wall pain. Not ischemic. But as I said, if this pain is triggered by effort, stopping you, pain, and sweating, this is likely to be ischemic. Straight away to the doctor, give you some pills to put in your pocket, plus other things which you mentioned before. Put a tablet under your tongue, and that they will disappear. But this is not the solution. This is a momentary measure. This is a momentary measure. You will have to take other treatments to prevent this, and it's a long story. It's another lecture.
Okay, we have get very nice from this program because we see the exercise and especially we see the food. We can, without cholesterol, we use the food for hepatitis, especially for hepatitis people. Thank you very much.
Great, thank you. Who else wishes to? None of you wishes to speak?
Yeah, excuse me.
Yes. Yes, sir.
Presentation was very useful, especially when I was talking to my section staff. Majority of them were saying that they don't have any problem why they should attend this presentation. So I'm going to tell them what we have listened to you here. And my message to all the colleagues is that start eating poor food.
Very good. Bravo. Any more comments? Okay. Any more questions, ladies and gentlemen? No more questions. This means yes? Yes?
Here in Nabhan, I was told that I had an QMI, and back in Sri Lanka I had the stress test, and the doctor said there's nothing wrong with me.
Nothing wrong with you?
Yeah.
And somebody told you have an MI
Yeah, I was in the ICU for 5 days.
for 4 days?
Yeah.
Probably the doctor was afraid to do a stress test for you because some people, when you do stress test for them,
I
they
was on
die.
treatment, yeah.
Yeah.
And but
But we do stress tests for people after the ICU to assess the prognosis. We do the stress test for different purposes. One of them to diagnose. You get a chest pain, we don't know. This is ischemic, not ischemic. When we stress you, you get the pain, you get ECG changes. Then you get physical changes where you stop, you sweat, you become pain, you get ECG changes, and this means that you are ischemic. On the other hand, we do it to exercise the patient to see his effort tolerance, especially people over 35, okay, to see whether they are suffering from heart or not. And the third one is for prognosis. After acute MI, we'll see how the heart is doing. So we exercise you to see your tolerance after the MI. And the last one, when you do, let's say, stents and you do grafts for the heart, we stress you to see how well was the operation done.
yeah, but there they said
Now, this guy, when he did not tell you did not need it, probably he was afraid to do it for you, because he saw a big man, and if you fall down on the treadmill, he's in problem. But in any case, if you were in the MI, in the intensive therapy unit, and was given as myocardial infarction, so the diagnosis is 99.9% is right, and you should get treatment.
yeah, I was
You're
on
not
treatment.
getting treatment properly because you should lose weight. You should be half the size.
The thing is
Stop smoking,
no, I was
you don't smoke. Exercising,
yes, every day.
very good. Dieting, this is the most important part. You should diet. You should choose your food facts. You could enjoy a great variety of, eat a lot of fish, eat a lot of chicken, take the skin out, eat a lot of vegetables. Vegetables are very good. They keep you healthy and at the same time they prolong your life.
No, what I want to know
For
is
many reasons.
no, what I want to know is like if I had non-QMI, that's what they said.
Yeah, I could.
I mean, after
It's just like you got a wound in the heart and it heals by fibrosis.
Does it show in the
On the ECG
ECG?
shows, on doing echocardiogram, ultrasound of the heart, it shows that moving properly. And if you do an angiogram, dye your arteries, it will show the area that is blocked. Not only the part of the artery that is blocked, it will show you the area of the muscle that is there. It doesn't move, it doesn't pulsate. It remains dormant. You see? We call it dyskinesia or akinesia. So a lot of things there you do. You can never miss a diagnosis of MI. But what is more important than that is the treatment should be active. You should be on anticoagulant, you should be on a statin, you should exercise, you should take drugs if you have got high blood pressure, diabetes to control them. There are a lot of things. Yes, sir.
Is diabetes completely curable?
Beg pardon?
Is diabetes
Yes?
completely curable?
Huh?
Is diabetic completely curable?
It is. Look, if we cannot cure you, we can prolong your life. Indeed, there are many diabetics, obese, both the family history, under some sort of mental stress, triggered diabetes, and after that what happened? Lost weight, okay, exercising, burning all the extra sugar without any treatment. What happened? But if you present with complications, as we said, then diabetes or the complications will never take permission from you. They never take permission. You've got to be careful, you've got to have your eyes open, okay? If you're but even then, as you've seen in the slide, when you have complications, whichever it might be, if you treat their complications and the diabetes and hypertension, which come together all the time, you could prolong your life for another 20 years, which is good enough. And this is the idea that, or the message which I try to pass to you today. I mean, I wanted to do this, to pass a message for you, to pass it to your colleagues, which I hope you will. Yes, sir.
Which method is better, magnetic resonance imaging or the ultrasound to monitor the...
Again, the question again.
Which method is better, magnetic resonance imaging MRI or the ultrasound method to monitor the restriction in the arteries?
No, well, the restriction of the artery, neither this nor that. You see, each one has got a different job to do. The ultrasound will show you the part of the muscle that is affected, whether it is moving or not moving. If it is ischemic, it doesn't move, it moves very slowly. We call it dyskinetic. If it doesn't move because it is dead, it is akinetic, this area of the muscle. It shows on the ultrasound. But it doesn't give you a clue about the arteries. The MRI doesn't give you an idea about the arteries, for many reasons.
But I understand.
But do an angiogram, you get a clear picture, you get the anatomy of the heart.
But I understand that ultrasound indicates the flowing blood.
The ultrasound does?
Indicates the flowing blood,
Yeah.
which is the better method as compared to the other X-rays or another method, which will show the static blood also.
No, the blood in the ventricle, but not the blood in the arteries. There are two things. If you've got blood inside them, yes it does. It gives you a beautiful and an accurate idea about the efficiency of the myocardium of the muscle. But I'm talking about the coronary arteries. It doesn't give you a clue about it. It gives you some markers about how bad they are, which part is affected, which part is ischemic, which part is dead, these sort of things.
Excuse me, there are a lot of herbal Ayurvedic medicines out there in the market.
Yes?
What is your opinion about
The
it?
herbal?
Yes.
Well, that's a good question. Actually, I have little experience with herbal things, but people say it's good. I don't object to that, provided I don't make experiments on serious patients, if they don't work. For instance, like garlic, a lot of things in the town, you see, which use daily. Garlic, onion, vinegar, plus a number of herbs. They say it's good, but I really have little experience. I haven't tried it. I try drugs only. See? Because these are measurable.
One question. For daily use, what is the dose of aspirin recommended? You are using
Yes,
aspirin.
small dose of aspirin. Now, if you have, let's say, if you want to prevent or make your blood thin, 100 milligrams of aspirin a day is good. But these days they say 200, 300, up to 1 gram is good.
Should it dissolve?
Usually the minimum dose is 100 milligrams. In fact, it was 75 milligrams. Then they made 81. And now they made it 100. This is the minimum dose.
Should you dissolve it in water before drinking? Or can
Doesn't
you...
matter. The most important thing, whichever way you swallow it with a bucket of water, with a glass of water, or with no water at all. As long as it gets inside, it plays the trick. Okay. Yes, sir? What?
Coated. He's having coating. Cortisol better now.
Cortisol?
Coated one. Coated is
Coated?
coated.
Yes, coated aspirin. If coated aspirin will prevent any ulceration in the stomach, yes. It's very good. And this is the trend now. All the aspirins are used now are coated. To prevent the complications. Yes. Any more questions, ladies and gentlemen? I would like to thank you very much for your attendance. And when you go out, there are two things to be done if you wish. We can screen you for these killers by doing a sugar test and do a lipid profile and take your blood pressure. This is free gift from the National Hospital, okay, not from me. And there are some booklets and a flyer to read. But please do read it at night, at bedtime. You know why? This will remind you of what you did this morning, and at the same time, you will dream of the killers at night, and the next day you will start preaching about the prevention of those killers.
We have one last question.
Yes.
If the diabetes is my family history,
Yeah.
what is the 100% I can protect myself?
There is no percentage, multifactorial.
Okay, if I eat healthy, if I did exercise daily,
Yeah.
if I
Lose weight.
not drink, lose weight,
You have got to have a body mass index of 22.
yeah.
Okay? Exercise, no smoking.
Even if it's family history,
Even the family history. You are not likely to become diabetic,
Yes.
not unless you violate
yeah,
what has been said.
yeah,
You see?
yes,
If you violate it, you'll get it.
yeah,
No stress, good diet,
yeah,
lose weight,
yeah.
activity, okay? But meanwhile, check your parameters inside, check your glucose tolerance. You may have an impaired glucose tolerance, you don't have to report that. You check your let's say, your lipid profile, if it is high, it should be lowered down, and then the chance becomes very remote.
Yeah.
But when you're got the family of diabetes, then this means that be careful. You might get it sometime later on. Or if you became careful,
Yeah. But you
you
know,
took action,
yeah.
then it is unlikely that you will.
Because when I make blood test for sugar, it's always 90, 95. So in the future, it might be coming more.
It becomes more when you violate what we said now.
Yeah.
I mean, the therapeutic lifestyle changes.
Yeah.
Slim, activity,
It's very difficult.
no lipid, no smoking, and no stress.
Yeah.
Live for your day, like those American, German generals.
Yeah, not American. American,
Sorry.
they are very fun. I know them. Yeah.
Because they're stupid. Yes. No more questions? So, those booklets, they're useful to you. And then, for the diabetics and hypertension, they've got charts to monitor your blood sugar. People with insulin, they've got special chart. People on tablets, they've got another chart. And for your hypertensive patients, you have got another chart. So, you monitor yourself, and if you wish to come and visit me at the hospital, I'll be more than grateful to do so. And thank you very much for being patient with me and attending my lecture.
Thank you, Dr. Richard. That was very, very informative. Please.
as mentioned earlier, we would like to have more and more of such presentations, such healthcare campaigns in the future. I would request all the attendees here, if you know doctors who are willing to come forward, help us in our march towards this goal, the new HR Millennium Project. It covers healthcare campaigns. We would like you to give us names of doctors who are willing to share their knowledge with us. We will contact them. Depending on the topic to be covered, we can prioritize their presentation. Please help us. Thank you very much.
Mr. Singh is the Assistant Director of the Human Resources section, which is the biggest section in Etisalat. He's very helpful, trying to help us in conducting this lecture, and I would like to ask him a few questions. Number one, what did he think of this lecture? Number two, what message would he like to pass to the others after attending this lecture? And number three, what does he think of further lectures for the people of the Etisalat and its impact on the people?
Thank you, Dr. Richard. As Dr. Richard mentioned, prevention, everybody knows, even the child knows, is better than cure. Even when you buy a car, you look at the meter reading. The car is in perfect condition, yet you go for servicing. Why? So that it can give you more life. Okay? You'll be safe on the road if you take care of the car. So if you're giving that much importance to a car, why not to yourself? Why should a person wait till one faints and then somebody carries you to the doctor? Okay, if you look at all these signs which doctor mentioned during the presentation, okay, anybody can look at them. We need not be doctors. These are very good tips. The presentation was very informative, right down to the lowest grade. I would say most of our staff are not very highly qualified. Even those less qualified were able to understand every bit and piece of it. Okay, so now we know what we should look for in ourselves. If we want a smooth, prolonged, normal life, we should look at certain things. We should take care of our health, our food, our habits. Good habits and as well as bad habits are very easy to catch and drop.
Indeed.
Okay?
Indeed.
So we have picked up a lot of good points from the presentation today, and I'm sure not only my colleagues, but those who attended the presentation, even those who did not attend, will get the message.
Lovely, great. And where would you send your patients in the future?
Doctor, I'm not trying to say this in front of you, but after you left the stage, everybody wanted your business card.
That's
Okay?
very kind.
They asked me for the location of National Hospital. Can I have his card? Can I have an appointment with him? I told them, I said, you have attended this presentation, just pick up the phone, call the doctor. I am from Etisalat, I have attended your presentation, I would like to come over for a checkup. This was the response of the presentation.
That's very good. I'm very grateful and I'm very thankful. This made my day, really, that I have achieved what I aimed at. And this is a great success, not only for me, but for humanity. Thank you. Mr. Yusuf, he is the director of the Human Resource Department, which is the biggest department in the hospital, in the Etisalat. And he attended the lecture, and I would like to ask him a few questions. Question number one is, what did he think of this lecture, and what lessons did he get out of this lecture, and what message would he like to pass to his friends and colleagues and relatives regarding the killers of the century.
Well, at the beginning, Doctor, please allow me to thank you and appreciate the effort that's been put for this lecture. Actually, I just checked with a few people and I found that they are extremely happy and they did not expect such a lecture. Came up to their understanding level, and the participation from their side also was acceptable somehow. This is due to the simplifying the medical, I would say, very advanced medical lecture like this. The lecture itself, it was very good. It touched a lot of area which is being ignored, available but unfortunately ignored in our corporation and even in our personal life. I have learned that we shouldn't ignore these symptoms or signs which we have there in daily almost, and be reluctant to attend the doctor if we don't have a real diagnosed sickness by the person, by the patient. This is what I have to say.
Great. And what message would you like to pass to your relatives?
Wallahi, they should be careful and they should watch themselves.
Great. Weight-wise?
Weight-wise, they
Lifestyle?
have... okay.
Smoking?
They have stopped. They should stop.
Great.
Okay.
And who's the first one to stop smoking?
I'm afraid it's myself.
Great. No. All right. Now, what in the future, if you have patients, to which hospital do you send them?
Of course, Doctor, after what have we seen from your lecture, National Hospital, I think it's going to be the best.
That's very kind of you. Thank you very much, Mr. Yusuf. Mr. Yusuf is the senior director of the human resources of the Etisalat, and he has played a major role in organizing the session